Greetings, Max McLeod, aka the Nutrition Ninja Doc, here to explain our approach to musculoskeletal pain and injuries. I've spent over 50 years intensely studying health, nutrition, fitness, and natural therapies. I've learned a lot and still feel like I've just scratched the surface. I constantly strive to put it all together to improve my efficiency at helping people to achieve their health goals. Correcting musculoskeletal injuries and helping people get out of chronic pain has been one of my main specialties because it's vital to quality of life. Pain comes from irritated nerves associated with muscles that are chronically contracted, trying to compensate for damaged ligaments and tendons. If you're human, you have most definitely experienced a musculoskeletal injury and pain at some point in your life. In the vast majority of cases, like 90+%, injuries and chronic pain are associated with damage to the connective tissues as opposed to the joint itself. This damage can be due to a single traumatic event, the accumulation of damage from several traumas, or from repetitive motion activities or injuries where there was no apparent trauma at all. Of course, over time, the other joint structures also begin to degenerate. Joints are held together and stabilized by ligaments. Joints are able to move due to the muscles which are attached by tendons. Most injuries are the result of damage to either ligaments, tendons, or both. When ligaments are damaged, they do not heal back to full strength. Anyone that has ever sprained an ankle can attest to that. They heal back, but with only about 50 to 75% of their original strength, and a bit longer than they were before. In the case of tendons, they're also weakened and may become chronically inflamed, especially where they connect to the bone. This leads to joint instability, which sends messages to the brain about the reduced stability of the joint. The brain does the only thing it can do. It sends messages to the surrounding muscles to tighten up to help compensate and stabilize the joint. This leads to chronic muscle tension and restricts blood flow, leading to reduced nutrient delivery, including oxygen. This eventually causes damage to the mitochondria inside the muscle cells, leading to reduced energy production, increased lactic acid production, inappropriate inflammation, restricted movement, and pain. Additionally, neuromuscular trigger points will tend to form, which leads to additional muscle tension in the areas not directly involved with the primary injury. Over time, all this leads to joint damage and breakdown, including calcium deposits, that is then referred to as arthritis. Our solutions. We use a blend of both the most proven, time-tested, and cutting-edge technologies to help restore proper integrity and stability to the joint, the damaged connective tissues, ligaments and tendons, and the associated muscles. Some of those techniques include joint decompression, shockwave therapy, red and near-infrared light therapy, electrofrequency therapy, trigenics muscle-brain re-education, and regenerative injection therapies, including prolotherapy. Additionally, we put a strong focus on proper nutrition and restoring and resetting the microcirculation. The microcirculation is the only place that nutrient exchange takes place between the blood and the trillions of cells of the body. Several of the approaches we use play roles in supporting proper blood flow and nutrient exchange to the damaged tissues. Each person's injury, pain, and situation is unique. There are different therapies and approaches depending upon your particular situation. It's important to have a proper consultation and examination for us to learn how to best help your body to heal. We'll design a program to help restore the damaged joint complex to get you out of pain and back in the game. Here's where it's important for you to understand what sets us apart from everyone else. There is no one that combines all the pieces required for total healing and regeneration like we do. We've been doing this for over 40 years and have continuously modified and tweaked each component to maximize the results and provide the best value. There are many offices that offer some of the things that we do, but none that, however, are experienced and put all the vital pieces together for you. As the disease care industry continues to evolve, and many realize that the old limited approaches, such as standard physical therapy, chiropractic, massage, acupuncture, and orthopedic surgery, have major limitations and flaws, many of these practitioners are finally beginning to open up to some alternative approaches, things that we've been doing for decades. For example, there are many docs that have jumped on the PRP, platelet-rich plasma, and stem cell bandwagon over the past several years. They are great techniques when properly applied. They are also extremely expensive and not necessary in most cases. They are simply modifications of prolotherapy, which has been around since 1937 and already had a 92 to 97% success rate. The problem is that very few doctors know how to do prolotherapy properly. They skipped over that steep learning curve because PRP and stems allow them to get good results with questionable technique. Unfortunately, this all too common poor placement accounts for many of the marginal results and failures of PRP and stem cell injections. There are additional factors pertaining to the quality of the PRP and stem cell solutions that we won't address here. We're all for healthy competition when it comes to healthcare providers. What we're not for is false and misleading advertising by those who inflate their experience and expertise, thereby leading people astray. Our office has the most experience of anyone in this region with regenerative injection therapy, i.e. prolotherapy. In fact, our founder introduced it to this area back in 1999. Additional details about prolotherapy. Prolotherapy is used to stimulate the proliferation and regeneration of connective tissue by attracting and activating fibroblasts. The technique involves carefully injecting small amounts of a mild irritant solution at specific locations called the enthesis. These sites are where either ligaments or tendons connect to the bones, depending upon which structure is being targeted. The enthesis is the site where injury occurs in most situations. The safe irritant stimulates a chemical messenger called cytokines to attract and activate a special type of cell called fibroblasts. Fibroblasts, once activated, will produce collagen and elastin proteins that strengthen the damaged connections, essentially re-welding those connections. Prolotherapy is simply a technique that tricks your body into thinking there's a fresh injury, thereby mobilizing, activating, and enhancing your body's natural healing response. It typically takes a series of 4 to 6 treatments that are spaced 1 to 3 weeks apart. This stimulates a gradual ramp up and building of new connective tissue to restore the original strength to the area. There have been over 150 studies published on the efficacy of prolotherapy. The first study was published in 1937. These studies consistently show a 92 to 97+% success rate at improving joint stability, reducing pain, and restoring proper function. The tragedy is that very few doctors know about it, and only a handful are proficient at it. It should be the primary tool used by orthopedic surgeons. However, most are not interested since insurance pays big bucks for surgery, and that's what they spent several years learning to do. Sadly, Medicare, being the illogical, brainless behemoth that it is, has chosen not to pay for prolotherapy since it is regenerative. For some bizarre reason, they do not consider it to be medically necessary, although they will pay for a joint replacement once the situation is allowed to progress to that point. Prevention and regeneration do not seem to be concepts that this agency understands. Of course, most insurance companies follow Medicare's lead and do not pay for prolotherapy and other regenerative treatments either, since Medicare won't. As ludicrous as that sounds, it is the reality of our current, hopelessly corrupt and inefficient disease care system. The good news is that the procedure is very cost effective, and most importantly, it just works. There's a tremendous amount of material about prolotherapy online, so by all means do your homework. Also note that our approach is quite comprehensive as we incorporate several other components to maximize your results. A quick word about cost. As much as we'd love to provide our amazing services for free, our landlord, staff, and overhead just don't allow for that. What we have done is to make it as cost effective as possible by providing up to 2-year no interest financing. You get what you pay for. The free stuff from Medicare and insurance companies simply doesn't work and can cause more problems down the road. Back to prolotherapy. In the vast majority of cases, 4 to 6 sessions will do the job very nicely. More severe or chronic damage may take 8 to 10 sessions, but that is only when the damage is very severe, has been there for decades, and the individual has a reduced healing capacity. Most people have heard about PRP, platelet-rich plasma injections, as well as stem cell injections. Prolotherapy is the predecessor of these techniques. They simply use different regenerative solutions as irritants and proliferants. In most cases, the significant increase in expense is not warranted since prolotherapy already has a 95+% success rate. Be that as it may, there are certainly cases and situations where it is reasonable to use one of the latest biological agents, like stem cells, to magnify and speed the regenerative process. If the damage to the underlying joint and connective tissue is extensive, or if the individual is not able to mount a solid healing or regenerative response, that may be a time to pull out the big guns and add some stem cells to the proliferant solution. Currently, the best choice is to use the latest biological regenerative agents from Wharton's jelly that contain a plethora of nutrients, growth factors, and stem cells. We can discuss this option as indicated or needed. As mentioned and briefly discussed earlier, there are a number of interventions that can be utilized to help your body to repair and overcome musculoskeletal pain and injuries. It's important to properly address both the underlying cause of the problem, which in most cases is the connective tissues, in other words, ligaments and tendons. It's also vital to deal with the muscles that have been called on to compensate for the weakened ligaments and tendons. This is where many of our other techniques come into play. Decompression helps to unload the joint, thereby allowing for improved circulation, exchange of nutrients, and waste removal. Acoustic shockwave therapy breaks up trigger points and scar tissue while increasing circulation and collagen synthesis. It's a fabulous tool that I'll soon do an entire video on. Red light and near-infrared light therapy help to increase circulation and oxygenation. They boost cellular energy production, reduce inflammation, and stimulate regeneration and collagen production as well. There are over 4,000 published studies supporting these mechanisms of action. We often recommend a home treatment system to enhance your recovery. Electromagnetic frequency therapy is a wonderful tool that helps to both regenerate and retrain damaged nerves in severe cases of degeneration. We mainly utilize it for peripheral neuropathy, which can occur from over 100 different conditions, including musculoskeletal injuries. Nutritional support is something that very few doctors are trained to understand and use. It's the very foundation of health and healing. It must be addressed since most people simply are not getting all the vital nutrients their bodies need to heal and function properly. We can't make you eat right and supplement appropriately, but we're sure going to try. We've been developing and manufacturing our own line of food-based nutritional support products for over 13 years. It isn't easy or convenient, but it allows us to provide the best quality and value to our patients and those who need to boost their nutrition to improve healing and performance. Few people are aware of it, but the only place that nutrients are actually delivered to the cells is via the microcirculation. This consists of the tiny arterioles, capillaries, and venules. Everyone's microcirculation becomes compromised with age and injuries, thereby restricting this process. To help correct this universal problem, we provide the only therapy ever identified to open and reset the microcirculation to youthful levels. It's called EWOT, which stands for Exercise with Oxygen Therapy. EWOT entails breathing high-flow oxygen while performing physical exercise to increase one's metabolic activity and increase carbon dioxide levels. It may seem counterintuitive, but it's vital to increase both carbon dioxide and oxygen at the same time, as this dramatically increases oxygen delivery to the mitochondria in the tiny blood vessels that have become constricted. A series of sessions revives and resets the microcirculation so blood flows freely, properly nourishing the trillions of cells of our bodies. As you can see, the process is comprehensive. However, not everyone needs all the components mentioned, but it's vital to have them available for those who do. We have pioneered, developed, tested, and refined this approach to the point where we know that virtually everyone can and will benefit. Our overall approach to preventing and correcting any and all health challenges uses a system we developed called the 4 M's that you won't find anywhere else. It focuses on restoring the microcirculation, mitochondrial function, metabolic balance, and building one's metabolic reserve or muscle. There are additional video presentations dealing with the 4 M's and each of those components on our website at ARTC.health. This presentation is longer than we had hoped, but it covers the wide array of things that are vital for proper healing and overcoming the vast majority of health challenges, including musculoskeletal injuries and chronic pain. There are no magic, simple solutions, although many will claim that there are. Do your homework, use critical thinking, and choose wisely. If that leads you to choosing us to assist you, we will do everything in our power to make sure that you are provided the best health care available anywhere to assist you and your body to heal itself while regaining full function and peak performance. Contact us today to begin your journey back to health. 941-805-5511 or email doc@artc.health, and then check out our website www.artc.health. Thank you for your attention.